Welcome back. Walgreens and CVS are putting in place coronavirus precautions for flu shots. Pharmacists will check temperatures, screen for other symptoms, and wear face shields for the first time while giving flu shots this coming season. Patients will have to wear face masks and are encouraged to schedule an appointment and fill out the paperwork online ahead of time. Both CVS and Walgreens are expecting a big increase in demand for the flu shots. And with the flu season right around the corner and then COVID-19 still being here and spreading across the United States, well, many health experts are worried about dealing with the two viruses at the same time. So here to explain and give us some perspective on the importance of getting a flu vaccine is Dr. Abby Olalade. She is from Sharp Reese Dealey. Good morning, doctor. Nice to have you on.
Good morning. Thank you for having me.
Well, you know, it's so important at a time where we're still dealing with COVID-19. It's already, August 22nd. We're towards the end of August. The flu season is going to be here before we know it. So we can't forget about flu season and what we need to do in terms of trying to, prevent getting the flu and spreading it. When does flu season officially start?
So typically around actually the end of August, but really there's no strict definition. It's really all dependent on when you start to see increased levels of flu in the community. And so that's why, as you said, it's extremely important to talk about what we can do to prevent the impact of having both of these viruses, which is very worrisome and has honestly kept a lot of us as medical professionals up at night because of the concern.
Yeah, and before we get into the details on what you need to do, I want to ask you, just as a doctor, being kept up at night, concerned about what is often referred to now as a twindemic. Doctor, we're talking about a twindemic possibly.
Well, the reason's because flu season already puts a lot of strain on our healthcare system and on our healthcare capacity. So with the onset of flu season, we do see already an exponential increase in hospitalizations, deaths, because the flu itself is dangerous and has a lot of devastating consequences. So when we are still dealing, like you said, very correctly, with the effects of the coronavirus pandemic, then it really is a worry because, again, it can affect our ability to care for people in our community. And certainly infection with one does not necessarily prevent you from getting infected with the other. So there might be situations where people have to fight off both at the same time.
Yeah. And, Dr. Olalade, I want to ask you about, typically, if I recall correctly, the flu shot isn't usually widely available until September, sometimes even toward the end of September. Have you heard whether or not the flu shot, because of what's going on with COVID, will it be available earlier?
Well, it's certainly based on what the CDC has said, will be available. And so, yes, sometimes in some cases we don't have it available in, in the medical community until September. But again, this is a season that lasts for several months. So getting it in September, for example, versus August may give you a longer time of protection during flu season itself. But it's important to get it when it's available and not so much focus on those things. It's just important to get it when it is available to you.
Okay. And again, some of the flu, let's talk about just, a lot of us already know what the flu is, but please remind us, what are the symptoms? And when you get the flu shot, what does that mean? What does that do to you?
So the symptoms of the flu include high fever, muscle aches, and just a generalized feeling of tiredness and fatigue. But again, it's important to remember that while most people do okay and get better, even people that don't have chronic or pre-existing conditions, you could still develop devastating consequences like pneumonia, again, having to be hospitalized, and unfortunately death. So when you get a flu vaccine, what that does is it creates an immune response, which protects you against getting the infection potentially. And in cases where, for example, the vaccine may not protect against the strain of flu that you get infected with, because again, it's not possible to protect against every single strain, it's important to remember that it can decrease the severity if you do still get infected with it. So that's something that we all need to remember.
All right, Dr. Olalade, thank you so much for your reminders and your perspective on the importance of getting a flu shot, even though we are dealing with a COVID-19 pandemic. Thank you. Have a wonderful Saturday. We appreciate it.
Thank you so much. You too.